the concept about hair transplant is very confusing for many people because they think that it could be a wig kind of a system, which is a hair piece which you just wear on the scalp. So obviously it's not that. It is your natural hair which is taken from the most resistant part of your scalp, which is not getting impacted by balding, which is usually the. So many people have this myth that this is going to enter the brain, it is a surgery on the head, it can be something which can cause damage to the memory or something of that sort. No, it's nothing like that. It's a very superficial surgery dealing with only the skin and till the depth of the hair root. So when we go in and take the hair follicle out, whether with FUT or the other technique which is called as FUE, where we punch out the individual follicles, take them out and then implant, is supposed to be understood by everyone out there is where you are getting the surgery done, by whom the surgery is going to be performed, what is the qualification of that person, what is the experience of that person. If you're going to a salon for a haircut and at the same place there are two technicians sitting and doing a hair transplant in an unsterile environment, it would be life-threatening, obviously. So that's the biggest myth, that people feel that, okay, this is why hair transplant I would never go in with because this is life-threatening or it would be very risky. It's a very safe procedure. It's something where you need to do proper research and reach the right person to get it done. That's all. Anyone who's claiming that they're giving customized treatments to a patient on the basis of a picture that you have sent them online is completely baffling for me, because it cannot give you the diagnosis. A diagnosis to be made has to be done. So your hairline is the signature of your hair transplant. If someone cannot give you a natural looking hairline, then you will never be in a position to get a great result. So when you go in for a surgery, before that, at least see 50 to 100 hairlines created by that surgeon, whether you like it, whether you can identify it's a transplanted hairline or not, how irregularly they have created that hairline, how beautifully they have taken that aesthetics. So if a patient is suffering from hair loss, please.
Dr. Mayank, welcome to Talking Through. Thank you so much for taking time out for this podcast. I really appreciate your time. And before we deep dive into your area of specialization, I like to know more about you and how and when you have decided to pursue your full-time career in hair restoration.
First of all, thank you for having me here. So yes, I entered medical in 1996 when I decided that yes, I want to be a surgeon. So that was the first goal, that entering medicine was all about surgery. Over a period of time, I developed that fascination for orthopedic as well as general surgery, and over a span of around 6 years or so, by the time you complete your internship, I was clear that I want to do something as a super specialist where you should do something very specific. So that's why when I was rotated in plastic surgery, it was something which was absolutely amazing because you transform lives. It genuinely means that you transform lives. Post plastic surgery, you have options to do a lot of things, like you can enter into cosmetic surgeries, you can go into hair transplants, you can do into reconstructive surgeries, burns, trauma, microsurgeries. So it has a plethora of things which you want to do, but I wanted to do something very specific. And at that time in India, there were very few people who were doing hair restoration services and giving extraordinary results. So when I applied for fellowships internationally post plastic surgery, I went to New York to Dr. Michael Beenher. He was one of the senior most people in this world where he was doing beautiful work of hair restoration. I stayed with him for a while and learned the basic skills. And then I decided that yes, this is something that I want to focus on, and completely stopped doing all the other aspects of plastic surgery. Just jumped completely into hair transplants.
And I know you have founded a company called Crown Hair Transplant.
Yeah.
So, what was your vision behind Crown, and when you have started this particular venture?
So Crown was about magical transformations. So we think about crown as a royalty in today's date, that there are no kings and queens. So obviously royalty doesn't exist to that extent. So I wanted a brand which should celebrate people who have been achievers, where they have genuinely done well in life, and all those people who were actually not having the confidence to face the world out there because of hair loss, were lacking that one space which would actually dedicate the complete thing to those patients. So that was the inception of Crown, and we came up with this in 2014. Since then, I have been running this for almost 11 years.
And for our audience knowledge enhancement, if I like to ask you in layman's term and very simplified terms, what exactly is hair transplant or hair restoration?
Yeah. So first of all, the concept about hair transplant is very confusing for many people because they think that it could be a wig kind of a system, which is a hair piece which you just wear on the scalp. So obviously, it's not that. It is your natural hair. It is your natural hair which is taken from the most resistant part of your scalp, which is not getting impacted by balding, which is usually the side and the back of your scalp, which is when taken, harvested, and implanted into the balding areas, they grow exactly like your natural hair. So you can style them, you can cut them. If you want, you can shave them, and they'll grow back naturally the way it is. So if it is done well, then probably a good transplant, you cannot even identify that someone has undergone that kind of a thing. So that's the basic idea about a hair transplant, vis-a-vis obviously the hair patches and systems which has been there for ages, which we all know that people have been there who have been wearing that. Some people call them topi, some people call them hair systems, some people call it hair patches. So all these, or skins also for some clinics or places where they run this business. The idea about a transplant is to get your own hair back in a manner where you don't have to worry about the maintenance part, that you have to go for a servicing or you have to go only to this place to get your hair cut done. You can style it and be careful.
And in your like 10-15 years experience in this particular domain of specialization, what technological advancement you have seen, and in future, what will be the new technologies will come into place which will enhance work of surgeons like you and experience of patients?
Uh, so that's a wonderful question. So first of all, if we look at hair transplant, it has been something which has been done since 1800s. It's not something which is recent. It has been glamorized in the recent past. But yes, it is something which has been running from that time itself. The only difference was that at that time, people used to take chunks of hair, like with macro punches, and then implant it like doll's hair on the head. So it used to look very unnatural. So you would always identify that, okay, there's something which has been fitted onto the scalp. Then came the advancement of a technique called as FUT, where we used to take a strip from the back, stitch that area. From the strip, individual follicles are dissected and then implanted. Very few people still do this technique. We are one of them. Around 5% of the
It's like
clinics,
minimally invasive sort of thing.
all the surgeries of hair transplant are minimally invasive because invasion means till what depth you are going, basically. So it's only till the root of the follicle. We are not going below that. So many people have this myth that this is going to enter the brain. It is a surgery on the head. It can be something which can cause damage to the memory or something of that sort. No, it's nothing like that. It's a very superficial surgery dealing with only the skin and till the depth of the hair root. So when we go in and take the hair follicle out, whether with FUT or the other technique which is called as FUE, where we punch out the individual follicles, take them out and then implant. Both the techniques are minimally invasive. With one technique, you will have obviously a line of scar which is a linear scar in the back because of the stitches. In one technique, you would have micro dot-like punches in the back, which would be like dot-like scars. So many people sell that as a scarless technique also. So this progression of advancement from macro punches to FUT to FUE, and now people have started giving hundreds of names. Every clinic puts a name that this is our patented technique, this is our patented technology, this is something which no one else is performing, which is only there to confuse patients. Worldwide, if we look at the techniques which are there being practiced today, it is only FUT and FUE. So this is the only two ways to extract hair follicles, and the implanting is done exactly in the same manner. So this is the sequence of advancement that has happened so far. As far as the future is concerned, there are very good things which are coming up in terms of the researches which are happening with hair. There's a molecule which has come up with UCLA. Recently, we have heard about it on social media extensively. It is under trial as of now, but that molecule is supposedly enacting in a manner that it can grow hair on the head in 7 to 10 days itself. That's what they're claiming. And it's on the third trial phase as of now. The first two have been cleared. So hopefully, maybe in near future, you will have some products which can help patients just with medication or application to at least restore hair. Apart from that, obviously, there are uh, things which are in research where people are considering cloning of hair, where you would probably take 40, 50 hair from the scalp, multiply it to thousands, and then implant it. Usually, the challenge in a hair transplant is that your donor is limited. The baldness is extensive. It is never in a position to compensate the amount of hair which we have lost, usually. Exactly. That's the challenge. So if you have cloning where you have thousands of unlimited hair coming in, obviously it's going to make things much more easier for the patients. Plus, there are additional many non-surgical therapies which are coming in, regenerative therapies which are coming in. So yes, this is a field which is growing by the day, and in the near future, I believe that it's going to be extremely, extremely good for a lot of patients out there.
That's good to know about so much of advancement in this
Yeah.
particular field. Great, great. And you briefly talked about some myths and misconceptions
Yeah.
among patients. So, basis on your personal experience while you're consulting someone in your clinic or day-to-day life, what are the top three misconceptions or myths in patients' mind nowadays?
So the first and foremost is that hair transplant is very risky. That it is a surgery where probably we have heard about some news elements as well, where people have lost lives to hair transplant while they are getting it done, unfortunately, or just after it. What is supposed to be understood by everyone out there is where you are getting the surgery done, by whom the surgery is going to be performed, what is the qualification of that person, what is the experience of that person. If you're going to a salon for a haircut, and at the same place there are two technicians sitting and doing a hair transplant in an unsterile environment, it would be life threatening, obviously. So that's the biggest myth, that people feel that okay, this is why hair transplant I would never go in with, because this is life threatening or it could be very risky. It's a very safe procedure. It's something where you need to do proper research and reach the right person to get it done. That's all. The second commonest thing about hair transplant is that people have this myth that it is going to be very painful, that it would not be tolerable because there are thousands of pricks done on the head, and so many incisions, so many punches being done on the scalp. Again, it's a totally comfortable procedure. With almost every patient I have operated on, I almost always ask them what was the grade of pain on 1 to 10. And everyone said it was 0 during the surgery. Only the time when we were giving the local anesthesia, probably it was 1 to 3 out of 10. So it's something which is very tolerable, like any local anesthesia procedure that you would do. Not something which is very fearful or you should be apprehensive about. And then there are some myths which are associated with a hair transplant causing loss of vision, a hair transplant causing possible sexual life going for a toss. So these are again things which are all extremely incorrect. Hair transplants can never cause anything to the vision. Obviously, it's got nothing to do with your vision at all. And as far as sexual dysfunction is concerned, post hair transplant, there is a medication which is called as finasteride, which is normally prescribed. So if it is given at a normal dose, then the chances of these kind of sexual dysfunctions may be in less than 1 to 2% of the patients. But there are some red flags where patients should not be given this medication, like if someone has a existing psychological anomaly or has had past history of any psychiatric ailment or depression or anything for that matter, or has been using some supplementation for the sexual life, then in that case, this medicine should not be given. There are alternates of this medicine to be given in a topical form, which can be just applied on the scalp. In such cases, you will never hear any side effects happening. So again, these are myths which people have this orientation that the surgery is causing these side effects, whereas it is just probably related to a medicine if not given properly.
And my next question is related to if someone is facing severe hair loss and they are looking for hair restoration. So nowadays there are so many advertisement in newspapers, social media, and other forums. It's very confusing to find and identify right person or right clinic they can go in and get themselves treated.
Yes.
So if someone wants to identify a right doctor, what will be the two three like the qualities they can look at or facilities in that clinic before choosing or zero downing to the clinic they want to get themselves treated?
Absolutely. So I'll address the first point first. So all these ads that we get to see on social media, with corporates jumping into hair business, basically, practically. Uh, Newspaper ads, very few people are now reading because social media is something which has taken over the print media practically for majority of the patients. Uh, Anyone who's claiming that they're giving customized treatments to a patient on the basis of a picture that you have sent them online is completely baffling for me because it cannot give you the diagnosis. All right. A diagnosis to be made has to be done by in-person examination of a patient, which is clinical examination with the help of some global photography, clinical examination, and then there is a device which is called as trichoscopy or folioscopy, where we put a probe on the top of the scalp of a patient and see about 500 to 1000x magnified views to see what is happening at a microscopic level on the scalp. Unless I have done that, I cannot tell if a patient is having a typical male pattern baldness, which could be a pattern loss, but it could have things which are mixed along with that. There could be other scalp conditions or pathologies that could run along with this. So, if it is a mixed picture and you are giving the same medicines to every patient who's coming onto your portal, it cannot be something which could be effective. That's absolutely not to be done. So, if a patient is suffering from hair loss, please visit a plastic surgeon or a dermatologist who's dealing typically only in hair loss. Any doctor who's doing everything, like if you go to a skin clinic and they're dealing with skin also and this also and aesthetics also and multiple things, their focus may not be on to what exactly is the treatment line. Specifically, if you have to do a surgical procedure, they may be good with medications, they could may be good with giving you treatments. But if it comes down to a hair transplant and someone is not working around this procedure exclusively, then please don't do it there. That should be very clear to patients. Second, obviously, look at the qualification of the people who are treating you. So, only dermatologist, which is an MD dermatology or a diploma in dermatology or a DNB in dermatology or a plastic surgery degree, which could be an MCH or DNB, where they have learned about hair and they are dealing with hair patients, are the people who would be treating you. So, if you go to either of these, then yes, it could make sense. But again, there are dermatologists who are not surgeons, who are not trained in dermatosurgery and are claiming to be hair transplant surgeons. And there are plastic surgeons who are claiming to be hair transplant surgeons but don't even know ABC about hair or trichology. Mm-hmm. So, when I started hair practice in the initial few years, I realized that this is incomplete knowledge which we have as plastic surgeons about hair. So, when I appeared for an exam called as a Diplomate of American Board of Hair Restoration Surgery exam, which is ABHRS, that's the only authentic exam worldwide which is psychometrically approved, which exactly teaches you everything about that hair. So for appearing for that exam, you already have to have 500 surgeries with your results to be sent to them. Along with that, they have their theory exams, they have their practical exams. So all these things is absolutely comprehensive and extensive. So when I prepared for that exam, that was the time that I learned so many mistakes which I was doing during my practice years itself. So that was something which added on to my feathers when I was a plastic surgeon with that degree. Then I became someone who could at least diagnose if the patient should not be transplanted.
And I have read somewhere that there are very limited people who have got fellowship from that organization, and they are the most qualified person to perform such procedures.
Yeah, so the fellowship degree is the fellow of ISHRS. That's a different organization. American board is the exam taking board. FISHRS is basically a fellow of International Society of Hair Restoration Surgeons. So this degree you would get, or the tag you would get only when you have worked for years in this industry. They have a point table system. So you have to have certain publications, X number of publications, some chapters and some textbooks which you have written, presentations which you have done in national and international journals. Plus, along with that, you should have given talks on different podiums. Then they also see if you have chaired sessions, you have practically organized conferences for people to learn, and also cleared the American board exam. So all those things are tabulated in the point system. Only when you cross a specific number of points, you would get that FISHRS. So there are only around 180 or 190 people throughout the world who have FISHRS. The good part is that in India itself, we have around 10 to 12 people who have this tag.
My next question is related to, uh, for example, I have a history of hair loss in my family, and if I want to get myself diagnosed or treated, are there any sort of like probes or any techniques wherein a person like you, who is specialized in this field, can predict up to certain extent that there are chances in future and I can start medication or maybe prepare myself for hair restoration 5 years down the line? Are there any techniques?
So I would say the clinical examination is the best way to go about it. There's no predicting thing because genetically you cannot predict whether it's going to be a kind of a gene which is going to express or not.
Mhm.
But in today's date, when we see younger patients also, there are signs which show and suggest that this could be something which can result in extensive baldness in a person who's pretty young as well. In fact, I have had patients who've come to me in the age group of 13 to 14 also started having hair loss already. The youngest patient who came to me for a hair transplant was at 19 years of age. Um, and that was something which we had to do because of the fact that he had gone into extensive depression, not coming out of his room, not looking into mirrors, stopped going to college. So obviously, the psychiatrist who was treating him, because we normally do not suggest that you go in for a hair transplant if you've not crossed 24, 25 years of age, then avoid going in for a hair transplant. Use medications, try to control it, and then we'll see later how it progresses. But this gentleman, because he was not in a position to deal with it psychologically, the psychiatrist itself told us that if this is sorted, then only his practical confidence is going to come in again. So we had to do it at 19 years of age, obviously explaining what are the possible side effects in future. Because the younger you are when you jump in for a transplant, the less predictable is to what grade of baldness you can go. So if you are pretty young and we do a surgery today, the donor area is limited. If you're using an X amount of the donor area today, you may require that the baldness is going to expand rapidly from 19 to 30, 35 years of age. That means every 2, 3, 4 years, 5 years with medicines also, you may have to do another transplant for him. So that's why we normally advise don't do this kind of a thing. But as far as prediction was concerned, when the patients come to us, if there is mild thinning of the hairline, which has started happening, which is known as the mild recession of the hairline, or there's a diffuse pattern hair loss which has started happening, some part of the scalp, the volume or the thickness which the patient used to feel before is not there. Or there are signs like whisker hairs are there where you will have thin hair just above the ears happening. So those are things which can reflect, and the moment we see those kind of thinning patterns coming in, we should put the patients on medication. So you should consult a qualified doctor, a dermatologist, plastic surgeon to go ahead and then take these medicines so that you would be in a position to maintain those hair for the longest possible time. Once you are in that age group where the hair loss is stable beyond 24, 25 to around 35, 40, that age group is a decent age group for getting a surgery done. So till that time, just buy time. That's about it. But there's no pro practically that I can put this and say that yes, you will have this. And neither is there any thing like a wishing ball which is there that we can just say that okay, this is going to happen. No, it's not.
Makes sense. Right. And in general, nowadays there are a lot of cases increasing of baldness
Yes.
and hair loss. Basis on your personal experience and the diagnosis before you do any procedure, what are the 3 4 main causes like pollution, maybe self medication or any other thing? Basis on your experience and how people can avoid any sort of potential hair loss because of any like such habits or conditions.
So again, these are all myths.
Mhm.
These are all myths. Hair loss in more than 95% of the patients happens because of genetic patterns which runs in the family. It could be from maternal or paternal genetics. It is not necessary that your father or grandfather had hair loss, that's why you have it. Or maybe they have it, so you will have it. It's not like that. It could come from either of the sides. The chances are, if both the sides have it and extensive baldness runs in both maternal and paternal sides, the chances are that it could probably affect much more at a much younger age as well. But in grossly, if we see, the genetic quotient is something which is getting enhanced by the epigenetics. Now, epigenetics is the environment which we are living in, where your pollution, your stress levels, your bad nutrition, more of junk food from outside, inadequate sleep cycles, no health related exercising, no meditation. So, obviously, those are things which will always enhance the speed of these things happening. That's why what we used to see in the initial days, like people having heart attacks and other things at 40, 50, 60, is now happening to kids at 18, 20, 25 as well. So, the same way, the hair loss that used to come in males at around 30, 35, 40 has started coming in 15, 20 age as well. So, um, definitely, if we look at all these perspectives, how you can avoid these hair losses happening is one, lead a healthy life. You cannot change the air where you're living. Like if you're in Delhi NCR, you know what you're breathing. But definitely deal with your body as the main temple. Don't indulge into activities like vaping or smoking or some other forms of addiction where it is going to hit your hair even more apart from your health. uh, Deal with good nutrition. So the concept of nutrition is pretty screwed out there for most of the younger generation, because everyone feels nutrition, let's have protein, let's have protein. It's not just protein, it's a balanced diet. You have to have some amount of macros and micros. You have to have your proteins, fats, carbohydrates in the right quotients. You have to have your minerals, your vitamins, everything in place. So, and that doesn't mean that you just go over the counter, pick up a box of vitamins gummies and start popping in. These are all supplementation. That is something that you should try to derive maximally out of your natural diet. And apart from that, if you want to add on, if you're deficient on something which is diagnosed by a doctor on your blood test profile and they are giving you some multivitamins, then take those vitamins. Then they are important for you. So these are things which people can do. And obviously, some form of healthy exercising, whether it's some sport or gymming or whatever works for you, is something that is going to be helpful. Sleep cycle should be very regulated. Screen time should not be extensive. So these are things which have been attributed to increasing the pace of hair loss for most of the younger generation people.
And Dr. Mayank, as we talked about, like identifying right patient, clinic, you have also cleared some of the myths. My next question is related to post procedure precautions. So, anything which patients need to take care of just to make sure that they are recovering well, or any alarming sign on which they need follow up from an expert like you?
So, first of all, if you've done your surgery well at a good place, then follow ups are always taken care of. So, like at our setup, when a patient comes to me for a surgery, once the surgery gets over, the patient is not in touch with my team. The patient is directly having my personal number. He's always in touch with me. He or she, whoever's undergone the surgery, is always in touch with me. And I see to it that I handhold that patient throughout that journey. The initial 10 to 20 days of the surgery is crucial, where there are lots of precautions to be taken, how you have to sleep, how you have to wash your scalp, what kind of shampoos you have to use. Sometimes people tend to develop minimal swelling, which can come onto the scalp as well, and the forehead and face also. So, how to avoid that? Then, obviously, taking care of the infections not happening. There are some certain medications which we are putting the patients on. So, all those things are taken care of in a proper manner as an aftercare. What patients tend to do incorrectly is that they feel the surgery is done, now it's over, and then they don't start coming in for follow-ups at the right time when you have been called. They don't share the images because the growth will in any case come over a period of time. Someone may get a 95% result, someone may get a 80% result, but the distinguishing percentage, the patients may not be in a position to identify that they have had. If you go with proper aftercare after a hair transplant surgery, you would always have the best possible results that would come in. So that's the basic gist, that the aftercare is something that is almost 40% of your surgery. The 60% work is done, but 40% of that aftercare, if you don't deal with it, if you probably just start smoking after your surgery or you continue smoking through the surgery as well, there are chances that the blood supply to the new roots may not reach in the right way. In that case, the results may not be great. So, by God's grace, I've never seen infections happening in our setup with any of the patients because of the fact that we take a lot of precaution and care with the sterilization of the equipments and the fumigation and of the operations theater and the surfaces where the patient is going to lie down. But yes, if someone is diabetic, if someone is a chronic smoker, and is getting a surgery done in a setup where they don't have the proper precautions and cleanliness and sterility, in that cases there are chances of even infections in hair transplant. So we have to be very clear that go to the right place, get it done in a setup which is a proper operation theater, not like a normal salon.
Correct. I have seen a lot of debates in and around in social media related to when someone is going through any hair restoration, the kind of hair which will regrow after the process is not as same as in terms of quality is not
Yeah.
similar, and maybe after 4 or 5 years they again there is a chances they will go bald. So is this because of the technique, like precision of that technique, or as we talked about, people are not taking good care post the process? What is the main cause behind that?
So the main cause about a failed result. So
Mhm.
failed result I classify is that as multiple facets of it. When we talk about a failed result, the first and the foremost is poor result, where the follicles have not grown or grown lesser, or you would see that baldness is still there. It has not given the adequate result. That kind of a failed result normally happens because of surgical error, not because of usually because of the patient. Surgical error could be in your prejudgment that you have not checked the patient properly. If you have not checked the patient properly, you've not done the trichoscopy, and he has a mixed picture of different pathologies on the scalp, it can cause a failed result. Or if the patient has continued smoking, like I explained to you, where the blood supply is already compromised, and then you are trying to put in a lot of density into that, so then the blood circulation will not reach to the new root, so they'll not grow. So this is one aspect of it where you would have failed results. uh, then who's doing the surgery? Like how you are taking out the follicles, even if it is FUT or FU, whatever it is. If someone is doing FUT, you're taking a strip out. Who's taking that strip out? Whether it is actually the plastic surgeon or it is a technician who's doing the job. When you are dissecting the follicles out of that strip, is it being done under microscopes? If the proper magnification is not being used and someone is dissecting the follicles out of the strip, that means you can damage the bulb or the bulge area, which is actually having the stem cells where the follicles can grow from. So in that case, the results may not come. Same thing happens with FUE also. Who's punching the hair out and taking it out? What kind of punch size you have used? What kind of punch you have used? Uh, whether it's a sharp punch, it's a blunt punch, what kind of a caliber you've used, whether you are in a position to encircle the follicle properly and take it out with all the possible structures of the hair together and then implanted it. When you've taken the follicle out, in how much time you're implanting it? The out of body time of that follicle is going to reduce your survival after 3 to 4 hours. So that means that it's not that if you've taken the hair out, you have to immediately implant. But once you've taken the hair out, you have to see to it that it does not dehydrate even for 5 seconds outside the body. If you leave it dry outside the surface, it'll die. So if you put a dead hair follicle into the skin, it will not grow. So there are multiple factors which can actually determine this. So that is usually because of the surgical error.
Mhm.
Then comes the unnatural results. You would see almost every day I get to see, at least because it's my job and my work. So obviously I see and I identify, okay, another bad hairline. Okay, another bad surgery done. Bad looking donor area with a lot of harvestation done, over harvested donor, the back looking bald in the area from where they've harvested has become bald. Or when they have implanted, they have drawn low flat hairlines, narrow foreheads, unnatural looking appearances, bad angles, standing hair follicles like this, or very textured of hair. Like if someone doesn't know that where you have to use the body hair to use as a filler to add density, and you've done body hair into the hairline, it will look unnatural. If you've placed multiple follicles into the hairline, it will look unnatural. So your hairline is the signature of your hair transplant. If someone cannot give you a natural looking hairline, then you will never be in a position to get a great result. So when you go in for a surgery, before that, at least see 50 to 100 hairlines created by that surgeon, whether you like it, whether you can identify it's a transplanted hairline or not, how irregularly they have created that hairline, how beautifully they have given that aesthetics. So these are all factors which need to be seen by the patients before they jump for the surgery. These are flaws which can actually create a devastating result. And obviously, then there are some problems which come along with the safety of the surgery as well. So those are also failed results because obviously it is compromising on the safety with causing infections.
And as you talked about the safety, so in recent past, there has been so many cases
Yeah,
in media wherein non-certified people have performed hair
yeah.
transplant and many people have died. So what's your take on it? While people are like, you have already given some of the advice with respect to how to identify a right person, but still, if some people they have landed up to uh, a wrong clinic and got themselves in a difficult position, what are the options they have
Yeah.
if things can be corrected while going to a right person?
So first of all, I'll ask everyone who's listening to this podcast that if you're going in for a hair transplant, don't jump in for a surgery if you don't have the budget for it. The majority of the problems happen is that this is a very price sensitive industry. People who have a paying capacity also don't want to spend. Those who don't have a paying capacity also obviously cannot spend. So they are looking for a surgery in 20, 30, 40, 50,000 rupees. A surgery which is going to take an entire day, where you will have equipments used, you will have consumables used, you will have an infrastructure used, a room used, your electricity, your everything else, and manpower along with that, along with the skills of the person who's going to do it, is it cannot be this cheap. It cannot be. If someone is giving you that price, that means they're compromising on all these aspects. That is the reason why you will land up in complications. Unfortunately, in India, more than 90-95% of the clinics are just delegating the work to the technicians. So you may consult a doctor in the office. The doctor is explaining you everything, drawing a hairline, marking everything. Then you go into the operation theater, and then you realize that the doctor is not to be found there. If this is what is happening, please stand up right there and go out of the OT. Don't get the surgery done. That is your best chance of getting out of that thing. Unfortunately, if you go in for a surgery with a technician based clinic as well, and you've gotten an unnatural result where you've gotten a bad hairline or poor growth, then please visit a proper qualified plastic surgeon or a dermatologist who's doing this as an exclusive work and is excellent at the corrective surgeries. Someone who's new into the field may not be in a position to do the same justice. So you have to look at someone who's experienced and doing this for the last 10 to 15 years at least. Hairlines can be corrected. It can never match a virgin hairline, what I would have created as the first hairline by my hand. But I can try to change the appearance of it. I can try to make it look more natural, more artistic. The hairline is one thing once if it is corrected. After that, your hair transplant just requires the kind of density or the coverage, which can be achieved if you have a remaining donor area. So till date, there have been around 8 or 9 patients whom I have said, no, I'm sorry, I cannot help you. Because they went to such a clinic where probably a technician had operated, got a surgery done where they had taken all the scalp hair, majority part of the donor hair. The donor was also looking sparse. They have taken the entire beard. They have taken the entire chest. Now nothing is remaining for me to work around. So obviously the chances of such patients getting a result with the entire baldness still visible is very less. So in such clinics, when they're doing surgeries, the number of follicles that are surviving is also less. They must have extracted around, say, 10,000 odd hair. But out of those 10,000, I could hardly see around 500, 800 hair on the scalp. That means the rest of the hair were either damaged while they were removing or they were kept outside the body for a long time before they were implanted it. So, uh, yes, if you had bad surgeries, go to someone who's experienced. If it would be something that could be helped, then yes, it could be a chance where you could still get a good hairline. If you get a good hairline and you don't have adequate donor area reserves for the future, in that case, we can go with a hybrid system also. Hybrid system is where you can get a front and temple kind of a framework done by a hair transplant in a corrective manner, and the rest of the area could be covered with probably a hair system or a patch. Normally, hair systems or wigs or hair patches look unnatural on the
Yes,
face. But when you have a hair transplant in the front and then a patch, like many celebrities are also wearing that kind of a thing, then you will not be in a position to identify it to that extent. So that becomes slightly more natural.
correct, correct. And before this podcast, when we are doing the discussion, you have told me about worldwide there are many black markets.
Yeah.
So can you tell us more about, so that our audience can also get to know what is happening across the globe?
Yeah. So not just across the globe, it's happening in India as well in today's date, which we had mentioned. So majority of the surgery is being done is because of the volume that they're catering to. All right. So there are places like Turkey, there are places like India for that matter. There are places across Asia as well where surgeries are happening at very cheap prices. So people are given packages. You fly in into the place, 3 days of stay with medical tourism, with your surgery, airport pick and drop, everything is included, and you have to pay around $1,500. You want to pick up in a limousine with a good accommodation, you have to spend around $5,000 in the same place. But what is happening in that place? What is happening is they have floors in the same building. Every floor has 30 to 40 beds which have been placed. Every bed has one technician or two technicians sitting. They are the people who are removing your hair. They are the people who are creating the spaces. They are the people who are implanting hair. And such places where the supervision or the procedure is not being done by the surgeon themselves is something which will always have a chance that you will have an unnatural or a devastated donor or maybe complications arising. Um, I would not like to name the person, but I had a patient who consulted me. Uh, I told everything to him transparently about the hair transplant. So when I discuss in my consultation, I take around 1.5 hours with the patient and run through the entire procedure. So when I gave him the insights into every aspect of it and told him everything, he was a big shot. He's into turnkey solutions for many of the celebrities, houses, and other things. So um, he was pretty scared. He was apprehensive that whether I should do it, I should not do it. And we tried to convince him that don't be apprehensive about it. This is just transparent disclosure so that you don't have anything which can come later as a surprise to you. The gentleman had an expo in Turkey, went there for his furniture and other things to be displayed. And one of his friends took him to the place where he said, come, I have a friend who's doing hair transplants here. He went there and he lay down there and got the surgery done because they said, we don't need any blood tests, we don't need any investigations. And he saw 40, 50 people being operated at the same time. So he felt confident that if so many people are doing it, it would be something which would be good only. Got it done 2 days ago. 2 days after that, he flew to a different country where he had his house. When he reached there, he started having pus pouring from his head. Everything around his eyes became black. Massive swelling happened on the face. Pus collected. Sebaceous glands were proliferated and inflamed. Like there were like swellings. You can multiple swelling full of pus was on the scalp. Got scared, called the clinic back. They said, we cannot help you. Go to a local plastic surgeon there in that country itself. Uh, Went to that plastic surgeon in that country, and it was just by chance that that plastic surgeon had undergone his hair transplant by me. And he said, I don't deal with hair, but if you want this complication to be sorted, go back to Delhi and meet the same person. So through the entire journey, getting that thing done there, and it was not that he was not affording. He had the means, he had every information where to go and do it. But still, we tend to fall prey to just this thing that if so many people are doing it, it must be right. It is not like that. So I'm not saying that if you go to Turkey, everyone is doing bad work. There are very good hair transplant surgeons in Turkey also who are performing hair transplants. Same way, like in India, like you would see at least good 20 to 30 doctors throughout India who are having world repute and are doing extraordinarily good work. But when we look at majority of the patients who are getting operated, where are they getting operated? You would have maybe 200 or 300 actual qualified surgeons and dermatologists who are genuinely doing that work throughout the country. But where are the rest of the surgeries getting done? There are 3.5 lakh surgeries being done every year in India. So how are they being done? They are being done by non-qualified people. Unfortunately, there's no capping which has been put as a system. So, as the president of the Indian Association of Hair Transplant Surgeons, when I was the secretary of this association, we had started uh, interacting with the health ministry and DGHS office and other places where we tried to implement a lot of things. So, there were regulations which were made with people who had been called as committee heads, as HODs of dermatology and plastic surgery departments, and there were norms which were laid down and regulations which were done. And once those regulations were laid down and submitted to the government, we still don't have a law which has come into place. It's been 3.5 years. So unless this moves faster, you will not have the kind of legal infrastructure so that accordingly people who are doing unethical work out there should be actually banned. or taken care of legally, right? So this is something which is the reality of this industry in today's date, unfortunately. But as a consumer or a patient, if you are looking at getting a hair transplant done, you need to be very much aware about these red flags. If you're going to a chain of clinics, like I know of a chain where they have almost 40 to 50 clinics throughout India, and in this chain, the people who are performing hair transplants claim that they are doctors and they are doing the surgeries themselves, and majority of them are dentists. So if you don't go and ask for the qualification, you don't go and ask for the registration number, you will not know what is the qualification of the hair transplant surgeon. So look at the degrees of the doctor. Don't shy away from that. Ask, what is your qualification? What is your medical registration number? In today's date, you can go to the medical council's registration site, you can put that number, see all the degrees the doctor has. It just takes 5 minutes. When you're buying a car, you look at 50 different things before you jump in for this. When you're getting a hair transplant done, at least look at basic things. Get your qualification checked, get your medical registration of the person checked, see to it how many years the person has been into practice, how many surgeries that person has actually performed. I know of people who have been doing hair transplants for 3 years or 4 years, and they are advertising we have done over 10,000 hair transplants. I've been doing it for 15 years, I'm still sitting at around 5,000 hair transplants. So practically, if you look at the years of experience, how many surgeries being done, what are the professional things that the person has achieved, there are very few people who would be falling prey to such traps which are out there in that case.
Doctor, thank you so much. I'm sure whoever will watch this podcast, they will get to know so many things, like basic things about hair transplant and hair restoration. You have cleared out many myths and misconceptions also. But before we wrap up this podcast, couple of things I like to request you. First is any advice for any budding medical professional who is interested in pursuing their full-time career or doing super specialization in this particular field, what kind of trainings they should do, what kind of certification they should go for, and what kind of like future outlook or any expectation they should bring in terms of like future growth, and any key message for our audience at last.
Perfect. So if someone is into medical already and pursuing probably an MBBS degree as of now and not knowing what to do in the future and is looking at hair transplant as an option, that someone wants to be a hair transplant surgeon, then first get the right qualifications in place. So the only two qualifications which I mentioned about very clearly was that either you can choose the path, which is a longer, much more stressful path of going in first and becoming a surgeon, then a plastic surgeon, then doing a fellowship of hair transplant, and then entering into it, which I followed. Or the other way is go into dermatology, do a fellowship of dermatosurgery. There are current fellowships with even the Indian Association as AHRS, which we are running, where practically people have the choice to go and be with the surgeons who have been experienced as a fellow and learn the art properly. And then you can start performing hair transplants. So these two things can be something which people can think of. I personally would still want that if someone is wanting to do hair transplants, then go the surgical route. That gives you an upper hand, that gives you the chances of having better sense of aesthetics as well, becoming a plastic surgeon. The surgical sense is much more, you are much more trained and experienced to deal with emergencies in that case, which sometimes dermatologists don't have unless they have taken special courses of those trainings as well. So a surgeon would, or a plastic surgeon would always have a upper edge in comparison to that. But likewise, as I mentioned, the plastic surgeon also needs to then learn about hair and trichology, everything in basic detail. At least this much that you can identify where to operate, where not to operate, where to probably refer the patient to a dermatologist to treat that patient. So these are things which should be very clearly understood. So these paths, either of them, they can be followed.
And
Okay,
any
next
key
question.
message
Yeah.
for our audience?
Young, in the age group of probably 16 to 25, started experiencing hair fall or shedding of hair. Don't get scared. Hair fall is not going to cause balding unless it is more than 50 to 100 hair in a day and continues for 6 months to 12 months. That's again a myth where people tend to understand that hair fall has caused balding. Hair fall is not causing balding. Hair loss is different. If you see thinning of hair, if you see visible spots, if you see recession of hairline, please visit a doctor. Start with medical treatments as soon as possible. Don't shy away from medicines thinking that this is going to be for life, that I'll have to take it, so I should not start it. Because once you've lost it, then you get a hair transplant done and then you still have to use those medicines. So start it young so that you would be in a position to buy time before a hair transplant. Jump in for a hair transplant only when you have the budget, proper research. See to it that it should be a qualified individual. It should be a plastic surgeon or a dermatologist who's exclusively doing hair and should do all the incisions and excisions on your scalp themselves. They should not delegate that work to technicians. Check all the patients' pictures, befores and afters, close ups. Talk to patients in person. Take numbers from the clinic. They would be having at least 50 to 100 numbers which they can offer. Talk to those patients at a convenient time, if possible. Meet those patients, see how they have experienced, ask them what was the journey like, whether the surgeon was available for them, not available for them, when the surgery was done, whether they were thrown away. It's not like that. So you have to have everything in clarity. Once you have everything in place, then you can definitely go ahead and jump in for a hair transplant.
Dr. Mayank, thank you so much. It
Most
was
welcome.
really like a knowledge enhancing and enlightening session for me. And I really appreciate the kind of honest advice you have given to all the people who will listen this podcast once we air it. And till then, I sincerely thank you for your precious time and look forward to meet you again. And we will discuss some other topics well in detail.
My pleasure
Till
entirely.
then,
Thank you so much.
thank you so much, sir.